All right, we are live on Mora Healthcare's Facebook page with Dr. Genevieve Hale, pharmacist, professor extraordinaire, our flu season expert. Um, while usually in the past, our Facebook Lives have been full of people, now COVID has normalized and we are back at work, back to school. So we understand that many of you might not be here today, but the beauty of technology is that all of this video will be on our Facebook forever. So you can refer back to it. You can check it out on our newsletter if you're a patient or if you're signed up for our newsletter. I think like our last post was the newsletter, and if you click on it, you can subscribe. It'll be sent out that way as well, and on our YouTube, so our YouTube channel. So thank you, Dr. Hale, for being here today. Every year, it's a pleasure to talk to you and update everyone on flu season. If you'd like to say hi, tell us a little about yourself and your involvement at MMR Healthcare.
Thank you so much for having me again. I'm always happy to spread the word about this important topic. You hit the high points about me. So again, Dr. Genevieve Hale. I'm a pharmacist that helps out at MMR Healthcare. Myself and I have pharmacy students and residents who are part of the team as well. As mentioned, I'm located at Nova Southeastern University, if I'm not in clinic, where I'm an associate professor there also. My specialty is in cardiology, but I do all topics. So with that said, vaccines is definitely one of the things I, again, am always happy to discuss with you further. And as was mentioned, that some of you might not be here today. If you do have questions after today, they will definitely direct them towards me after the fact, and I'm happy to answer those now or later.
Sorry for that little interruption. Everything's okay now. But you were saying that, especially if they're patients or anything, they can contact you, right?
Absolutely. Yes.
The beauty of Dr. Hale is that she's always around, if not in person, by phone, or we can get you in contact with her, especially if you're a patient. That connection that we formed with NSU and Dr. Hale has been such a benefit to our patients. So as always, thank you so much for all you do with us.
Thank you. My pleasure.
All right. So if you're in the live, I see it. I see one. Hey, how you doing? We are so happy to have you here. Of course, if you stick around, we have some questions already written up for us to talk about today. But if anything comes to your mind, any comments about comments that we make here, or any questions you come up with yourself, please drop them in the comment section. And we might not address them immediately, but we definitely will address them before the live is over. So go ahead and do that if you'd like. So let's get started.
Okay.
Let's talk about the most generic question, because classically, throughout these times, fall is equated with flu season in its most basic sense. We know that fall comes around and someone in the family is going to get sick. It's bound to happen. So can you just describe exactly what is the flu?
Yeah. So, and right, unfortunately, if it's someone, it's going to be someone close or someone indirectly that you're probably going to see come across to this. So the flu, in short, I guess it's a contagious respiratory illness. So meaning affects the lungs, affects the nose, affects the throat, and these, what we call pulmonary areas of the body. So it's a respiratory illness at the end of the day.
Awesome. And so if it's a respiratory illness, we know that it's going to deal with breathing issues, your nose, congestion. But what is the best case scenario for if you get a flu, and what is the worst case scenario if you get the flu?
Yeah, so I guess the easiest way for me to answer this is to talk about what are common symptoms of the flu.
Right.
So the common symptoms you'll see out there would be fever, although not everyone gets a fever. A lot of people do get a fever when they have the flu. Cough, sore throat, stuffy, runny nose, muscle ache, general body aches in general, headache, fatigue, tiredness, and even nausea and vomiting, especially actually in children with this. And it could lead to more severe things, such as pneumonia, fluid, really bad fluid filling up in the lungs, and that would require like a hospitalization situation. So, best case scenario would be you have some of these symptoms and they're not severe and it can be taken care of at home. Worst case scenario, you could wind up in the hospital. And if it's not treated, especially in those cases, patients do pass away from the flu.
Wow. That's crazy to even hear because, the flu is always around and we think of it as something very simple and easy. And these days, not many people pass away from the flu. So the idea that if you don't have preventative care or, in worst case scenario, sometimes your bodies are bodies and they're going to respond the way that they do personally and differently from other people. So to think that it could be fatal is something that we don't really think about. So it's important to keep that into perspective. But usually we can assume that we'll be okay for the most part, right?
Correct. However, different patient populations have higher risks of complications.
Right. Yeah.
So, what do I mean by that? In particular, patients who are elderly, so they're 65 or older, this is the highest risk patient population that I would worry about if you don't get vaccinated or take preventative measures, getting hospitalized or passing away. I actually looked up numbers before today. In 2020, 50% of the people hospitalized for the flu was those 65 and older. The next group of people I would worry about is also very young children. So those newborns up to 4 years old, about 22% of hospitalizations back then were children. 50 to 64 years old, it drops to about 16%, and everybody else about 9% with hospitalizations and further complications. So, and even though maybe you don't know someone who's passed away from the flu, it actually usually is in the top 10 causes of death in the United States. The last time it was number 9. So, yeah, it is a really serious complication that we do need to take. We have to worry
We have
about.
to take it seriously.
Yeah.
Wow, the more you know, because for us, I feel like for the normal person, it's just the flu.
Right. Right.
So we know that these are possibilities. We know that this can happen to anyone and it can happen in specific populations more than others. But what can we all do and to prevent that?
Yeah, the most important question probably we're going to talk about today. So the best way to prevent is to get vaccinated with the flu shot or influenza vaccine, which every year we should be getting vaccinated with this.
Excellent. Yeah. And is when we get vaccinated, I feel like, everybody knows what a vaccine is,
Mm-hmm.
but they don't really know what a vaccine is, right? We know it's a shot that you get and it's supposed to help you not get sick.
Right.
But let's talk about what the flu vaccine is. So, would you let us know, is the flu vaccine a live virus? And explain a little bit about a live virus versus, I don't
Sure.
know, a dead virus.
Yeah. Actually, that's correct. So, vaccines are not all created equally. They are different vaccines. So I'll answer your second question first. So, live virus vaccines. So, the best example I can think of is the MMR vaccine, which is the measles, mumps, and rubella vaccine that most of us get as children. This is a live vaccine, meaning they use a live version or real version of those viruses. What we call inactivated or attenuated, fancy words, either means a dead form of the virus or a weakened form of the virus. So with the flu vaccine, there's technically 3 different types of flu vaccines. So there's inactivated flu vaccine. So that is not live. That is a dead version of the virus, the flu virus itself. There's what we call recombinant vaccines. They use a protein of the virus, so not a live version either of that.
Okay.
Both of those you would get. That's the usual one I think most of us would think of, that we get the shot in the arm. The flu vaccine also has a third version called live attenuated vaccine, which gets people nervous sometimes because the word live's in there. But what this is a very weakened version of the live vaccine. And all three of them have the same amount when it comes to like any kind of side effects, if any at all, that you're going to get. With that last version, that's actually a nasal type of vaccine. So that one's not so commonly used.
What is a
The other
nasal
ones,
vaccine?
yeah, yeah. So
Yeah.
not used. It's not
Yeah.
preferred how you have to take it,
Yeah.
um, and it's not recommended for actually everybody. Where the other one from the arm, that's the preferred one to go with.
Right. So basically, a live vaccine has a weakened version of the flu in it
Right.
to form antibodies. Is that
Correct.
correct?
Correct.
And then a dead vaccine, which is what we usually get, what most people get,
Yes.
has the makeup to form those antibodies without actually giving you the flu injected into your body. Is
A
that the
a
gist of
hundred,
it?
100%. Yep. So
Okay. So
in
if I
all,
understand, hopefully they understand.
yeah, yeah. So in all scenarios, essentially what's happening is you're getting like a copycat version, for a better way maybe of putting it, of what the real flu virus would be. So it introduces this to your body as like this fake version. So then your body understands, gets the instructions on how to produce these antibodies, which is the protection, um,
Right.
to prevent from getting ill from the flu.
Okay. So another part of understanding the vaccine then would be if it's preventing the flu, what is its success rate at doing so?
Yeah, so this is a really good question. I actually made sure I checked this too before we talked today. So
Okay.
what's great is over time, the effectiveness of the flu vaccine has gotten better and better, and you would of course hope that over time. So it can range in effectiveness between 50% and even up to 75% in most adults. And actually, I saw this morning, even in children, some of the vaccines have even been up to 91%. And that's preventing against
Oh,
hospitalizations and severe symptoms from occurring.
oh wow.
Yeah.
That's those are great numbers to hear.
Yeah, I got it off the CDC website in case anybody wants to find the numbers I'm talking about.
Okay, great. Yeah, that's I've been to the CDC website a lot in the past 2 years, so I I like going there because they break it down into very separated sections so you know exactly the topic and easy way of reading it. So if you do have any concerns or questions further, that's a great resource to go to as well.
Yes,
But thank you for those numbers. It's really good to hear that we're not just doing it because we think we have to, but because we know it really works.
exactly. Yes.
All right. So, one of the hot questions, and maybe this goes a little bit along with the previous question we asked. I think there's a lot of misconceptions about this, but if I get the flu shot, can I get the flu from the shot?
Yeah, definitely like top three questions
Yeah.
I'm always asked too. So, fortunately, the answer is no. You cannot get the flu from getting any of the flu shots that I've discussed. So, because again, they're either made of a dead version of the virus or a protein or a very weakened form, you're not going to get the flu from the flu shot. So, it's
So,
great.
if I do get really sick, is it coincidence or is it just bodily response? Is it what would you chalk that
Yeah.
up to? Or is it personal to patient experience?
Well, it's really more the last. It kind of varies on the person. So it could just be the timing of everything. So,
Mhm.
for example, if let's say I was at a family party yesterday and there was like 50 people there, someone had the flu and I got the flu from being there, but I got the vaccine the next day. It would be easy for me to say, "Oh, great, now I have the flu because I got the vaccine." But
Yeah.
probably, or actually, I should say, in that case, it was timing. I already
Yeah.
had it. My symptoms started up around the same time I got the vaccine. Um, and so for most cases, this is what the case actually is. It's just the timing of when you've come in contact with either it's the flu or any other virus and also getting the vaccine.
Right. It's true. And so, let me see. We I can't remember if you exactly talked on this, but I know from experience at the office, are there different dosages or different vaccines based on population?
Yes.
Uh, so like is there a different vaccine specifically for kids? Is there a different vaccine specifically for seniors? Can you
Yeah,
touch on that?
great question. So, and let me say this too. In general, everybody 6 months and older can get a flu vaccine, should get a flu vaccine. The difference in doses come in when a patient is 65 years or older. They do have what's called a high dose flu vaccine. Um, what this means is so the variants that are being covered with this vaccine versus the normal vaccine, this would be like the same stuff is being covered. The only difference is the amount of antigen, which just means the thing that helps your body produce the antibodies, is about 4 times higher in the high dose vaccine
Oh.
than in the not high dose vaccine. The reason we want to do this in 65 or older is, again, what I've talked about earlier, because this is the patient population that's most at risk for
Mhm.
complications if they get infected with the flu.
Okay. So, what would be the best time or of time of year to get the flu vaccine?
Yeah, so most people agree that the sweet month to get the flu vaccine is October. So anytime before the end of October, so October 1st, October 31st would be the best time to get the flu vaccine. With that said, I know that pharmacies have already started giving out the
Yeah.
flu vaccine, now in September. So if you've already gotten the flu vaccine, don't worry, it's not the end of the world. You will probably be just fine with that. You do not need to get a second dose if that is what you've done. Also, with that said, if for whatever reason you're unable to get the vaccine in October, you wind up getting it in November, December, etc., that is fine too. Get it when you
Get
can
it.
get it. But if you can get it in October, that would be the best month to be getting it. And we actually at MMR, for those of you who are patients, we do have a flu vaccine clinic. So every Tuesday and every Friday, Tuesday morning from 9 a.m. to 12 p.m., Friday, afternoon from 1 p.m. to 4 p.m. We are actually, I will physically be there myself with my students and residents. One of us will be helping to actually administer flu vaccines in the clinic.
We're so excited to be offering that to our patients, by the way. So we'll have that available to our patients 65 years and older because we will be having specifically for the flu. And correct me if I'm wrong, but for specifically for the flu vaccine, we'll be having the higher dosage meant for 65 and older.
I believe so, yes.
Right. So that flu clinic will be specifically for, or rather, we're calling the vaccination clinic will be specifically for that in regards to the flu shot. But we'll also be actually having a COVID-19 booster available, right?
Yes.
So, and we'll be talking about those boosters actually right now. But is there anywhere else that we can get the flu shot? Can we go to any pharmacy? Is that okay?
Correct. Yep. You can go to any pharmacy also to get the flu shot. Pharmacists are allowed to vaccinate anybody at the age of 3 and older. So
Oh,
that's almost everybody. If you do have a child or a grandchild who's younger than that, they would get it at their pediatrician's office.
okay, great. So if you're not a patient of MMR Healthcare and you're not 65 and older, any pharmacy will do. That's good to know. Let's jump into the next hot topic. And what I just mentioned that we'll be having the COVID-19 booster available as well at the MMR Healthcare Vaccination Clinic. By the way, starting October 1st, I think you said that, but um, well, there is a lot to fall and flu season, right? Because we think traditionally we've always thought about it as flu season,
Mm-hmm.
but there's more that comes along with sickness than just one virus, right? And obviously we've faced in the past almost 3 years now. I don't what
Yeah.
year is it? I don't even know anymore. After 2019, I forgot.
Well,
Um,
I'm with y'all blended now.
it's all blur, honestly. But yeah, so COVID-19 is a big part of that flu season now too. And I've always wondered, and I actually don't know the answer to this, so I'm excited to hear from you. is is COVID going to be, or has it shown in record and projected to be like the flu in the way that it spikes during the fall?
Yeah, so unfortunately, yes. Over the last 2.5, almost 3 years, we have seen since 2020, yeah, since 2020, that between the months of December, January, February, we see this spike with the COVID-19 virus. So it does go hand in hand with the flu virus as well. I mean, both of them have to do with the respiratory illness. People are usually more, not maybe Florida, we have the sun all year round, but most other parts of the country, people are more indoors because it's colder, ventilation therefore is a little less, and holidays.
Holidays,
So
okay.
these all play a role with that spike.
I figured. And, we remember canceling or making holiday dinners shorter or smaller because we didn't want to expose too many people. So now maybe just taking that mentality and, in the past 3 years, we've been extremely strict about it, but maybe taking that mentality, seeing what's comfortable for you and your family,
Right.
addressing your own personal needs, seeing like, do you have a 65-year old or immunocompromised grandma, or are you all healthy and young and can risk what comes along with the fall sickness season? So
Exactly.
definitely adjusting and seeing what you're all comfortable with, but always knowing, just as Dr. Hale just said, COVID is like the flu in the way that it spikes during fall and flu season.
Mhm.
So we're talking about being around people, and we've experienced the last 3 years, but what's the protocol now? Because time has passed.
Yeah.
We're all relatively back to normal. I would say honestly, especially here where we are back to normal, most people are gathering just like we were before. But what's the protocol if we do get infected? What's the protocol if I know that I'm sick and I have to go to work, or
Right.
there's a holiday party, or any different circumstances?
Yeah. So there's a few things to consider with this question. So the first thing is if you test positive or negative. So if you do take a COVID test, you test negative, you have no symptoms, you're good to go. You don't need to worry about isolation, anything like that. So now if you wind up in this case testing positive for COVID, the next things you need to think about are, do you have symptoms? Do you not have symptoms? So if you do not have any symptoms, the protocol there, and I wrote it down because this is going to get a little complicated, so bear with me and please interrupt me if this makes no sense. But what you need to do is first, you'd count day one as the first full day after you tested positive. And if you do have symptoms, you count day one as the first full day of having symptoms. So that's why the symptoms, no symptoms, first off, is an important
That's
thing
the
to
big thing.
note there. Um, you want to stay home for at least 5 days. So if you don't remember like anything else I say with testing positive, you want to stay home isolated for at least 5 days at your house away from others. That even unfortunately includes if you live with someone, people in your home, try your best to separate as much as you can. Use different bathrooms, use different utensils, um, have the wall essentially.
Yeah.
And if you do need to leave your house, for instance, like if you need to get food or, if there's an emergency or something, wear a mask if you do need to do that. Um, After the 5 days, if you again don't have any symptoms, then you're good to go. With the caveat of if symptoms do develop, now you got to start your clock over. Day one
Oh,
is
wow.
when you develop symptoms. Does that make sense so far?
Yeah.
Before I keep going, okay.
So if I test positive
Hmm.
on Monday, but I
Hmm.
don't get symptoms until Thursday, the
Right.
clock starts over on Thursday. I take 5 days from Thursday, not from testing positive on Monday.
Correct. Exactly.
Okay.
Yeah.
It makes sense because if I have COVID and I have symptoms and I'm coughing on someone,
Right.
that's more dangerous than if I have COVID and I'm not coughing on anyone.
Exactly. Correct.
That makes sense.
That's a yes, very good way of putting it. So now, let's say I had symptoms from the beginning, my 5 days have now passed. So at this point, if you are no longer using any medications and to help with a fever, then or you don't have a fever at all, then you can end isolation. You can leave your home, is essentially what that means. However, if the 5 days have come, you still have a fever, or you're still using Tylenol or Advil to help reduce a fever, you should still stay home until you're 24 hours without those fever symptoms or using medications for fever. The last thing I'll say is whether you can leave home at that point or not, the CDC still really does recommend that you continue to wear a mask for 10 full days, even though your risk of passing it on to other people is lesser after the first 5 days. It's still possible for the full 10 days.
That's, yeah, it's important to, because I can spread symptoms to anyone everywhere, even if I feel all better, because
Exactly.
it can stay in your system, correct? That's
Correct.
another question. We didn't write this down, and I even experienced it myself when I had COVID a few months ago.
Mm-hmm.
Um, a rapid after, I think I had it for about 10 days.
Okay.
Like
Mm-hmm.
I isolated for about 8 days, and then on the eighth day I was able to go out, but because I didn't have any more symptoms, but I was still testing positive on a rapid for 10 days.
Yep.
But after those 10 days, even I think a couple days after, I went and took a PCR.
Uh-huh.
It was coming up positive.
Yeah.
Can it stay in your system without being transmittable?
So this is a really good question and kind of a little difficult, but the quick answer is yes. So it depends on the test, which is why I'm happy you brought up that it was a PCR that you
Right.
took later on. So without getting like totally into this, so at home tests versus PCR tests are more sensitive and specific. So sensitive actually that even if you still have a dead form of the COVID virus in your system, it will pick that up and you will still remain positive. Where the at home tests, it would have to be like uh, a live,
Right.
and that's why usually having symptoms, you'll test the positive with the at home test, where if you don't have symptoms, taking the PCR can really help with that situation. So that is why, especially with a PCR, you can still test positive. I mean, in the very beginning of the pandemic, I knew patients who it was months they were
Right.
testing positive for a long time. Back then, we really weren't too sure what to do, but we figured they still weren't contagious at that
Right.
point. So in general, though, after 10 days, you're usually not contagious. Um, but I will use the caveat of if your at home test is still testing positive, I would definitely contact either your pharmacist, physician, nurse to discuss that situation further.
Wow. Yeah, that's important to know, because yeah, it's so confusing. You don't
Eh,
know you don't know who to believe, but but that makes more sense. I get it there. So we're uh we're talking about COVID-19. We know the protocol now. We know what it's like during fall, but so there's also this discussion about boosters and
mhm,
vaccines for the COVID-19 virus. Just recently, the only reason I know it because my doctor mom told me. I didn't even fully, the media is not picking up as much. There's not as much news circulating about it, but
sure.
now we're seeing a new booster coming out.
Yes.
So can you tell us about what to expect and why maybe new boosters are coming out, and
Mhm.
what decisions we should make when we go in for our next COVID vaccine?
Yeah. So first, I guess I'll answer what is this new booster
Right.
that's going on. So just recently, the FDA, CDC, the Pfizer, Moderna manufacturing companies all have gotten together and created what we now call. You're going to hear this word bivalent vaccine. It's just a fancy way of saying that this vaccine now has two types of variants involved in it. So the original vaccine, the one we've been getting all this time, it had the original form of the COVID-19 virus. as we've probably all picked up on over the 2.5 years, it has morphed into these like Delta, Beta,
Yeah.
except Omicron now variants. So with the new vaccine, what's really great about it is you still have the original variant in this vaccine, but now you also have the component of the Omicron variant included as
Okay.
well, which is great because that's the one that's prevalent. So for, I will say, like, kind of for the first time, we are finally like getting ahead of the game, or at the playing field with what's really
Right.
happening here. So that's really awesome. When it comes to like, okay, so do I need to get this updated booster? When should I be getting this updated booster? What other things should I be asking myself with these questions? So it also depends on the timing of when you got your last shot, if at all. So first, I guess, let me say, if you've not gotten any COVID vaccine at this point, but now you do want to get a COVID vaccine, what we call the primary series, or the first two shots with Moderna or Pfizer, those are going to be the original vaccine.
Okay.
The updated vaccine is purely just booster vaccine. So after you've gone through your first two shots, now you have the option of now you have to actually get the bivalent booster vaccine. Also, I should say, when you're getting a booster, you don't actually have the choice now to get the original or now get this new one. Now, all pharmacies, anywhere you get this, any booster, it's going to have this Omicron component to it, which makes sense because,
Yeah.
I mean, I don't know. I would definitely want to have like the most updated, best thing for
Yeah.
what's attacking us at this point. So there's that. If you've gotten vaccinated, also for the most part for adults, you can get this booster 2 months after your last booster or original primary series. So essentially 2 months later, you can do that. With children, it gets a little more complicated.
Yeah.
This is now approved for those 12 years and older. So those 11 years and younger, the CDC hopefully will be meeting this month to discuss that further for this booster. But for as of right now, this booster can be given, the bivalent booster, for 12 years and older.
Gotcha. So, you said something that made me think, but I'll think about it. But so we get the booster, and we I have the same basic conversation as the flu vaccine.
Mm-hmm.
We know we have to get the booster. We know it's there. We know it's going to stop us from getting sick. But what actually is it? Is the COVID vaccine a live virus, or is it a
Oh,
dead virus?
yeah, I forgot to touch on that. Yeah, so it's not a live virus. So it's interesting because the Pfizer and Moderna, the ones that are the most available out there,
Mhm.
they're what we call mRNA vaccines. So they use the smallest part of a protein to show our bodies how to defend against this. So not live at all. So just like the question before, you can't get COVID from these COVID
Right.
vaccines. Um, there is the Johnson & Johnson vaccine that you don't see available all that often anymore. This was called a viral vector vaccine, which again, not a live vaccine. And now we have Novavax also available, which I haven't seen that often either out there in practice. This one uses a protein of the virus, not live. So
Okay.
it's none of them are live vaccines.
That's good to know. I remembered my question too.
Okay.
You talked about the time frame between shots,
Mm-hmm.
between your original and your booster, or your booster and another booster.
Right.
But what about a time frame between having COVID and getting boosted?
Yeah, great question. Thank you for asking that. So, what the CDC recommends is if you do get COVID, to wait at least 3 months before getting the next shot, being probably this
Okay,
bivalent booster vaccine. So,
3 months.
yeah, 2 and 3, it's kind of like enough already, right? We got a lot to
Yeah.
remember. But so, if you do get COVID, it is recommended to wait 3 months before getting this booster.
All right. Good to know. So, what are some of the side effects you've seen of the COVID-19 vaccine? And let us know, is it, if we feel really sick, if that's a side effect, should we be worried like we worry when we get COVID and get really sick?
Yeah, so definitely. So most commonly, you're going to have what we call injection site reaction. So just like where you get the vaccine, you might have a little redness, a little swelling
Yeah.
your arm, just where you actually got the shot might hurt a little bit. For the most part, that's what people are complaining about. You might feel some body aches, you might feel a little tired. And again, those are pretty common. It is possible for people to get low grade fevers. Usually that subsides over a day, but that's usually the worst that you're going to see. Now, if you do have more severe symptoms than that, like you have issues like breathing or you break out in crazy hives. I've actually, for what it's worth, not seen this at all. But
Okay.
if you do have some kind of severe reaction, you should call your physician's office right away.
Right.
It is not usually, it could be because of the inactive ingredients, which there aren't that many. So that's why we don't really see this that often at all. So
Okay.
that's the nice benefit too of these COVID vaccines.
Great. So we got the vaccine. We're all boosted. Yay, hooray. But
Yeah.
what does that mean? What is the prevention rate? Does getting the vaccine guarantee not getting COVID?
Yeah, so it's actually kind of two different questions. So, the whole point of the COVID vaccine is to prevent against hospitalizations and death. And it does a fantastic job of doing that, even with the original trials.
Keywords.
Yes, even with the original trials, we saw up to like 95% effectiveness. I mean, so that's honestly like I've been doing this for almost a decade now. Seeing numbers like that for anything is amazing.
Yeah.
So when it comes to though preventing infections, preventing any symptoms from if you get infected, not and actually they don't have numbers off the out there, but you do have unfortunately the risk of having what's called a breakthrough infection is what we're
Mm-hmm.
calling it. Usually it's a very mild case of COVID if that is what happens. And I would still say, like, again, even though this can happen, it's important to be vaccinated because, I mean, I'll take the chance of
Right.
feeling sniffly versus winding up in the hospital. So that's the point of getting the vaccines.
I'm surprising you with this question, but I just thought of something else because I know a lot of people talk about it, but does the vaccine do anything to prevent long haul COVID?
Oh, yeah, it's a great question. And there's a lot of research ongoing on this, but so far what we found is that it does help prevent long COVID. And I'll be honest, we are going to still learn so much more about long COVID as years go on because COVID's new, so therefore long COVID or long-term effects of COVID is new to us. And that can range from feeling foggy for a very long period of time to things like we've seen blood clots and stuff like that.
Wow.
So it really ranges what this could be like months, weeks, and months after having a COVID infection. But to not get too off track to answer your question exactly, the vaccines seem to definitely help against this. So that's
Yeah.
yet another reason too to get vaccinated.
Yeah. Well, it's important also to remember that 3 years is nothing in science,
Yes,
right?
correct.
I mean, it takes decades to understand a virus in its totality and
Yes.
anything in science in its totality because it takes um, precedent, right? So,
Uh-huh.
uh, one thing we're also learning about, I think, is also the risk of reinfection, correct?
Correct.
So,
Yes.
as we understand this virus and as we get to know it more and its effect on us with and without the with and without the vaccine, let's get the vaccine so we are better prepared just in case, and we're better prepared so we don't get hospitalized or risk fatal circumstances.
Absolutely. So important that message. And it is true. There is a lot we still don't know. We are learning every day from this, but what we do know is that the vaccines do help prevent against serious complications.
Awesome. Sorry if you hear my dog in the background. He's a he's a chatty one, I guess.
He wants to talk about COVID too, I guess.
He's like, COVID, get over it. No, COVID, get over us. We want you out of here.
Exactly.
So another question that we had actually in the comments as well is when we're thinking about getting all these vaccines, because now we're there's so many vaccines to get, right? We're also offering the pneumonia vaccine at the office in our vaccination clinic. That's something that comes along with fall flu season as well. So that's three vaccines in and of itself: the flu vaccine, the COVID-19 booster, the pneumonia shot. When should we get these? Can we do it all at the same time? Should we wait between shots? What's the best way of going about it?
Yeah, so and experts kind of go a little back and forth on this question, but for the most part, technically, you can get vaccines in general all at the same time. Now, with that said, though, it has been, I think, best practice, especially with the flu and the COVID vaccine, to usually wait 2 weeks apart if you can wait 2 weeks
Right.
apart. So if you can't, let's say you're traveling or whatever, there's some circumstance and you can only get it the same day together, fine, get it the same day together. You're not breaking any rules necessarily, but it's usually better practice to separate 2 weeks out, particularly with these two. The only time you absolutely need to separate vaccines in general out is if we're talking about live vaccines, which today we're not talking about any of those. Those you would have to wait a month between each other if you don't get them on the same day.
Okay. And so why is that best practice to wait a couple
Yeah.
weeks?
Yeah. So there's a few. The main reason, really, being is particularly with the COVID vaccine that it is newer. It's something all of us have not done before
Yeah.
2 years ago, just to see how we do react. As I mentioned earlier, most of us, like 99% of us, are going to be totally fine getting these. But if you are in the rare cases where you do have a reaction, if you do get the two vaccines at the same time, it's kind of hard now to decide was it the
Which
flu
one?
or was it the COVID or vaccine? Not really sure. So that's the
Yeah,
main reason why you would want to do that. But with effectiveness of the vaccines, they'll work just fine either way.
right. I mean, it's like anything. If you drink a cocktail with too many liquors in it, it's not gonna taste good. It's not gonna feel good.
Yeah.
You know, you shouldn't mix as much, but you can. It won't hurt you, but maybe not. Maybe we
Right.
should choose a different route.
Exactly. I love your analogies today.
Because sometimes I'm surrounded by medicine all the time, but people forget that I'm still just a civilian. I'm just a regular person without a scientific education, and that's all of, if not most of our patients and the people on Facebook Live and all that kind of stuff. So I really hope that if you aren't understanding something, you're commenting or calling your physician or a pharmacist that you trust to get these questions clarified for yourself, and also on a personal basis, because also you never know, maybe it's your first time ever getting the flu shot and you're a 1 in a billion situation where you do react negatively. You have to have that conversation with your providers and your pharmacist and understand that. Um, so that's really all so wonderful to talk about and to learn about. And so we can we we can get the booster at the 2022 MMR vaccination clinic. We can get the flu shot for 65 plus older and the pneumonia shot. Is there anything that you want to touch on the pneumonia shot as well?
Um, yeah, not so much. It's recommended in those older, so 65 and older for sure, 50 and older actually too, possibly. So if you can get it, get it. I guess that's the main thing.
Yeah.
Pneumonia is also unfortunately a leading cause of death every year, particularly in older age groups. So that's why too, just like we were saying with the flu vaccine, it's important to get the pneumonia vaccine for that reason as well.
Awesome. Well, this was an incredible update on this year's approach to flu season. Now we know it's more than just that, but thank you so much for sitting down and talking with us. As every year, we love to get the update, and it's important to do that because what happened last year is different from what happens this year. So if you all have any more questions, you can still leave it in the comment box, and either Dr. Hale will get back to you, or I can get the information from her and be able to respond to you. Any personal medical questions, of course, contact your doctor. We can't discuss that over Facebook, but we are always a resource for you if you need anything or you need to be connected to anyone. Thank you, Dr. Hale. I hope to have you on here soon again.
Absolutely, would love that. Thank you again for having me. And for those who are listening today, thank you for being here. For those of you who are going to be listening in the future, thanks for tuning in. Also, as mentioned, I'm happy to answer any questions now or in the future. So be safe, everyone, and get your vaccines.
All right. See you then.